So we are so excited to bring up these next set of storytellers. You're going to be hearing about some of the highlights of our community engagement efforts, whether it's through clinical services, community partnerships, consultation relationships, or professional supports. We know that while the Mailman Center serves over 15,000 children annually, there's over 500,000 children in Miami-Dade County alone. So we know that community partnerships and community work is so vital to increase access and engagement into services. The work of the next set of speakers is just, they're really amazing people, but they're also some of the hardest working individuals I know because community work is really hard. And their commitment to community engagement is truly inspiring to me and has been influential on my own career. So in this presentation, we will have Dr. Emily Banstra, who's a professor of clinical pediatrics in the Division of Neonatology. She's also the director of the University of Miami Perinatal Care Program. We have Dr. Alana Mansour, who's an assistant professor of clinical pediatrics. She's putting on different hats for this presentation as the project director of Families First and co-director of Team Coach. We have Dr. Ruby Natali, who is professor of clinical pediatrics. She's the lead of community wellness and interprofessional collaborative, and I get to work with her on several projects, and she's just a joy to work with. We have Betty Alonzo, who's the president and CEO of Connect Familias. Most of the things that I know about community engagement is from my time with her, and I'm just so glad that she's here to share. We have Dr. Nelly Garcia, who could never leave the Mailman Center. You know, like all those people who have longevity, she is one of those people that just needs to stay here. She is just amazing to work with. She's an associate professor of clinical pediatrics. She's our director of innovation and community engagement, and also the director of Team Coach. And then we also have Joanne Palenzuela, who's a manager of social services. I get to hang out with her on our Jumpstart Plus program, and she is also just a joy to partner with. All right, with that, we will have Dr. Banstra.
Thank you, and good afternoon. This has been a wonderful occasion to honor the Mailman Center, which has truly been a beacon of hope for our community for many years. Let's go back to the setting in Miami, Florida, the nation's epicenter of the cocaine epidemic in the 1980s and 90s. A glut of powder cocaine, easily converted to cheap, smokable crack cocaine, was being shipped from Colombia through the Bahamas to Miami, where it was heavily trafficked, especially in our inner-city neighborhoods. Soon the epidemic affected our most vulnerable mothers and babies at Jackson Memorial Hospital, where we had not only had record numbers of births topping out at 16,000 a year, but we also had record numbers of cocaine-exposed babies. Unfortunately, the media and lay public had little sympathy for moms addicted to cocaine who were delivering so-called crack babies, perceived to be without hope for a normal life. Yes, cocaine and crack are dangerous drugs that can cause cardiovascular complications and deaths in adults and even in pregnant mothers and their offspring. Early reports of placental hemorrhage, fetal death, fetal growth retardation, congenital anomalies, and abnormal infant behavior were emerging. At JMH, preliminary screening showed that nearly 12% of our inborn babies were cocaine exposed. Among African Americans, the figure was nearly 1 in 5. Our nurseries were overwhelmed with border babies awaiting disposition to safer homes. In that era of compelling need, I shifted my research focus from studying intraventricular brain hemorrhages in premature infants in the NICU to the acute and long-term effects of an in utero cocaine exposure on infant neurodevelopment, and perhaps beyond. I called my new mindset thinking outside of the isolate. With funding from the National Institute on Drug Abuse, we launched the Miami Prenatal Cocaine Study known as Baby Steps. We comprehensively assessed a large cohort, one of the largest single-site cohorts in the nation, of prenatally cocaine-exposed and non-cocaine-exposed inner-city African-American infants from birth to young adulthood and found relatively subtle but important differences in neurobehavior, mother-child interactions, early language, and emerging executive functioning in the cocaine-exposed versus control groups. Essential to our research was mentorship by senior faculty, Dr. Gwen Scott and Dr. Mary Jo O'Sullivan in the HIV/AIDS research that was being done in our community with this intersecting epidemic of drugs and HIV/AIDS, and the late Dr. Charles Bauer, the director of Early Steps. All three of them were direct mentors for me and even introduced me to the community and the setting in which we would be doing our research. Critical to our success was also our dedicated interdisciplinary team of faculty, research and service personnel, and students and trainees affiliated with the Mailman Center and with the Bachelor Research Institute. Collaborations with community partners such as the Florida Department of Health, Children and Families, Education, Transportation, drug treatment programs, and the Model Drug Court for Families also blossomed and informed our work. Our collaboratives with them provided the impetus for innovative and sustainable community-based prevention intervention projects, including our Healthy Start program, the Families First Network, and the Jasmine Project, among others. For decades, we've been fortunate to serve thousands of at-risk children and families through multiple streams of federal, NIH, NIDA, ORWH, SAMHSA, HRSA grants, state grants from Healthy Start and the Florida Department of Transportation, and local grants from the Bachelor Foundation and from the Health Foundation of South Florida. We're very grateful for the Mailman Center and the Bachelor Research Institute for all of the support that we've received, including the beautiful facilities that we work in. They are the beacons of light in our community. So now let us turn to Dr. Alana Mansour, who will highlight our Families First network, followed by Dr. Connie Morrow, who will present the Jasmine Project as examples of some of the ways that our Miami prenatal cocaine study left a legacy in our community, not only for substance-exposed babies, but for babies at risk due to mental health issues and other environmental issues in our community. Thank you.
Thank you so much, Dr. Banstra, for all of your contributions to the field and for being an amazing mentor. So taking what we learned from the Miami prenatal cocaine study, in 2004, we wanted to further increase access to much-needed services in the community. So we collaborated with approximately 10 community partners and other experts across several disciplines, and we applied for funding for the Families First program. We were fortunate to be one of the first parenting programs funded by the Children's Trust. And since that time, we have nearly doubled in size and now have over 25 community partners, including the United Way Center for Excellence, Trinity Church, City of Doral Parks, Miami-Dade Public Libraries, the Debbie Institute, KLA Schools, and the YWCA, just to mention a few. Our partners work very closely with us to provide evidence-based parenting services to at-risk families of children birth to 3 residing in Miami-Dade County. We offer 2 free parenting groups in English and Spanish throughout the day and in the evenings. Baby and Me is for caregivers and their infants birth to 6 months, and our Incredible Years toddler curriculum is for parents of children 1 to 3. I'm proud to say that Families First has been recognized nationally for its incredible work supporting families. Our program would not be so successful without our funding agency, the Children's Trust, our amazing staff, and our incredible community partners who host our groups, help us recruit families, and provide us with ongoing feedback to ensure that our services are of the highest quality and meet the needs of the families in the community. Now I would like to share a video with you about another one of our incredible programs that brings much needed services into our community, the Jasmine Project.
The Jasmine Project is a national Healthy Start home visiting program funded since 2010 by the Health Resources and Service Administration. In Miami-Dade, unfortunately, Black babies currently die at a rate nearly 4 times greater than white babies. The Jasmine Project is focused on reducing these disparities in infant deaths and preterm births, as well as improving maternal health. The project enrolls Black pregnant women in 4 zip codes in North Miami-Dade with the highest infant mortality rates. Home visitation and care coordination services are provided throughout pregnancy, through the birth, and until the baby is 18 months old. Our services are infused within the community and tailored to meet the individual needs of each family. Our Jasmine Project team provides services in the family's home and on-site at our community-based office located in Trinity Church, which is in the heart of our project area neighborhood. The Jasmine Project is also a key community stakeholder in the fight to improve maternal-child health in Miami-Dade and leads a community action network of more than 25 partners to address the collective impact goal of reducing infant deaths for our most vulnerable mothers and babies. The Jasmine Project is 100% focused on ensuring that every baby celebrates their first birthday.
Similar to the progression of the Families First and the Jasmine Project, the Early Discovery Program has also evolved over many, many years with a focus on bringing services into the community. But specifically, this program is designed for children with disabilities. Here's a brief video showing the progression and impacts of our program from my mentors, Dr. Gold and Sheena Benjamin.
In 1989, when I first started here at the Mailman Center, I was appalled to find out that 3- and 4-year-old children were being bused to the Mailman Center to receive evaluation and intervention services. I wanted to change that and bring those services out into the community. We started doing screening, evaluations, and interventions very successfully.
Right.
Head Start was so ahead of its time. And they were mandated by the federal government to include 10% of their children with special needs. And then I thought, what about subsidized child care centers? So we wrote this project.
The Preschool Inclusion Project gave us an opportunity to go and enroll child care center directors and teachers who were apprehensive about having children with special needs in their classrooms. And so when we addressed them, they became engaged. They had the children in the classrooms with them. And then after the large group settings, we would go into the classrooms with our individual team members and provide these services. Then the parents got involved too. So the parents got education from this program. And then it moved from the Preschool Inclusion Project to the Enterprise Zone Preschool Inclusion Project because we wanted to focus on those areas that was most vulnerable. And we got to go to all over of Miami just to make sure we reached as many children as we could.
So we started working with community partners.
We developed the Early Discovery Program, which came out of a partnership with a lot of community providers, the Young Children with Special Needs and Disability Council. And they came together and realized there were these kids that were falling through the gap by just a small cutoff of 1%. And the amazing thing was 90% of the children that receive our services do not need special education. We follow these families after they're done with us and realize, the parents tell us, they're no longer in special ed. Your program has been just amazing for them. And we have tons of letters that talk about really the quality of the services that we provided and the need that we filled in the community.
That's so amazing because not only does it save children and parents, it saves so much money.
That's right.
And the program just continues to grow. We serve about 507 families plus more. We don't close our wait list as long as we have funding and as long as we have space available, we will serve them. And we provide behavior, occupational, developmental, and speech intervention, either in the home, in the child care center, really whatever's convenient for the family, we try to accommodate and meet that need. And we do a pre and post-test evaluation so we can monitor progress and see the improvement that we made, but also see where they fall by the end of the program.
At the beginning of the program, my daughter was below average in her gross motor skills and her receptive and expressive language. But after the 12 sessions, she was able to jump with 2 feet. She was able to climb upstairs alternating feet. She was engaging more in different activities for longer periods of time. She can recognize colors in both Spanish and English. But most importantly, she can communicate better now, and that was something that for us was really important. We are very thankful with this program, especially with her therapies. She gave us all the resources and the tools that we needed in order to help her at home.
The vision that went from so many years, how children with special needs can be a part of the community, participate fully, it's an amazing thing to see.
And it started off small. You remember,
Yeah.
there was only 60 children in the pilot project, and now we serve 500-600 children a year.
We've touched
Tens
many
of
lives.
them, yeah, tens of thousands.
And I also wanted to point out that the expansion of our services really would not have been possible without our community partners. They are the ones in the field that really enables us to serve thousands of children each year. And so thank you to them and the years of partnership. And so now I'd like to turn it over to Betty, one of our amazing community partners.
I'm not going to go on the podium because I'm going to be different for a minute. We need to change it up a little here. So you can start it. So first of all, I want to say thank you for inviting us, and thank you for the partnership and the journey that we've been on for many years. Watching the videos and watching the history of Mailman Center, I realized that I actually started touching Mailman Center a long time ago in my previous life when I was in philanthropy, and I got the pleasure to work with some of these projects that are being highlighted. And fast forward, it was a few years back, more than I like to count, that we were at a Children's Trust meeting, and Dr. Lambert and Walter was there, and he introduced me to Jason. And he said, you need to listen to the work that Jason is doing with the PCIT. I was a little skeptical, I'm going to be honest with you. They sold it a little hard, and I was like, there can't be this good. It was. It was better. The only challenge that we were facing was that it was here at Mailman Center, and the families weren't making it here. We had an access problem, and we also had a challenge that because it was competency-based, it may take longer than some families were willing to stick it out through. So Jason and I got together, and like with everything that happens, there is no funding, there's just good minds and good hearts. And we started to plan this journey. We didn't know what it was. We said, let's cross-train each other. Let's cross-train our teams. We didn't know what it would turn out to be. We didn't have any idea. Well, we kind of did. But we were hoping, right? But we started to think about the journey on how do we cross-train each other. Ruby, if you'll go, that video, oh no, sorry. And we took an approach that really started to innovate us, and we got into a journey, a participatory journey, a community engagement journey, a journey that continues to this day. So I'm not going to say history was written, because we're still co-creating, co-innovating, and co-designing. And we're really excited about the work that we've been able to produce, the results, but it's not about me, it's not about Jason, it's not about Mailman Center, it's really about the families that we're touching. And so don't listen to me. Don't believe me. We're still working with Maya. All of that is true. But this families, they're the benefits. And I can't say enough. And our teams are so integrated. I have two of my key staff here today, Jeanette and Juliet, who have been integral in making this happen as well. So I want to say thank you to them. Thank you to the Mailman Center. We don't know, and the team, we don't know where we begin or where we end. And that's the way it's supposed to be.
Antes de estar en el programa de PCIT, era muy complicado la conducta de ASBI, era una conducta muy irreverente, tanto con todos en la familia, con el hermano, con nosotros. El servicio de PCIT se destaca porque está dentro de la comunidad donde yo vivo, que es en la pequeña Habana. Era muy fácil para mí trasladarme tanto caminando y que la promotora también nos visitara en casa. Era súper cómodo también porque es en el idioma español, el idioma que nosotros manejamos. Nos ayudó a tener estrategias para manejar la conducta de ASBI, también estrategias no solamente con ASBI, sino con el hermano y con toda la familia. La comunicación mejoró bastante para todos. ASBI ha mejorado muchísimo en la conducta, es un niño que se destaca académicamente bien. La familia está totalmente bien, el hermano, todo ha mejorado en la familia. De verdad que ha sido maravilloso y muy positivo. Siempre recomiendo este programa.
Thank you, Betty. It has been amazing to see the work that's been done at the Mailman Center to increase access to services by bringing them to the community, with programs like PCIT and so many others mentioned here today. And while this work has impacted the lives of so many children and families in our community, we also recognize that our reach is limited through individual programs, which is why in 2018, when the Children's Trust released a funding announcement seeking to fund professional development support for the 40-plus parenting programs funded by the Children's Trust, who together serve over 10,000 families each year, we were thrilled about the opportunity to extend our reach and our impact. So we applied. And in 2019, we heard the wonderful news that Team Coach was funded. We've spent the last 4 years working collaboratively with the Children's Trust and our community partners to develop a successful and sustainable model of professional development support that really leverages community provider expertise to develop supports that align with community needs and values. I'm incredibly proud of the work that Team Coach has done, and I also recognize that it could not be possible without our community partners, without our amazing team, and of course, our funder. So thank you. And I want to end by turning your attention to the screen to hear directly from one of our community partners and from the Associate Director of Programs at the Children's Trust.
Almost 3 years ago, we started attending the peer learning meetings with Team Coach, which were really, really amazing. It was a great way to connect with other providers and share our struggles with serving families during the pandemic. We were all able to make connections and network while also supporting one another. We would refer to these meetings as our monthly support groups. Shortly after, we started working with Team Coach one-on-one with Nellie and Amanda. What started off as just needing help with enhancing our flyers turned into a total program tune-up. New goals were born each meeting, and before we knew it, the quality of our program reached new levels.
These meetings have been so productive, but what we love the most is the genuine desire they have to help, the expertise they display at each session, and just simply how down-to-earth and caring they truly are. A few months ago, Team Coach asked us to join them in developing training content that the other parenting providers will be able to benefit from. We are so excited to continue this journey with this amazing team.
Thank you so much, Team Coach.
Congratulations, Mailman Center. For the past 5 years, the Children's Trust has been working with Team Coach as a Trust Academy partner to greater the benefits of what we are bringing to our children and families. Team Coach uses training and coaching, online courses, and communities of practice to work with our providers who offer parenting services in groups and in-home visits. We are so appreciative of the team of Jason Gent, Nellie Garcia, Drew Rothenberg, Natalie Espinosa, Alana Monsmore, Amanda, Juliana, Abigail, the whole team, for not just making sure that our providers are great at their evidence-based programming and curriculum, but really are making the families work together stronger with their children and making our community better. Thank you for bringing your expertise, Mailman Center, and congratulations on 50 years.
It's my pleasure to turn it over to Dr. Natali to talk about the Jumpstart program.
Thank Thank you. So as our beautiful city continues to grow and we welcome some of our youngest members, we have a program designed specifically to help young children, especially those with challenging behaviors, succeed in early education. We accomplish this by supporting child care centers through a program called Jump Start. While Jump Start is now a well-known county-wide program, what you may not know is it started as a small pilot Dyson grant, serving only 3 child care centers per year. Now we serve over 100 child care centers and thousands of children each year. I invited Joanne Palenzuela, who is a lead program coordinator on Jump Start, to be here with us today to discuss the progression of our work. Joanne has been with us since the very beginning as a trainee on the Dyson grant and has worked with us on all of the various phases of our expansion. So take it away, Joanne.
Thank you, Dr. Natali. Thank you for also welcoming me as a trainee and being my supervisor, now my director. Jumpstart started in 2007 and went from 2007 to 2018. In 2007, the services were provided to teacher consultations and direct services to children in preschool settings with a focus on social emotional development. At the time, we could only provide direct services for 3 to 5 children per program. We were able to service 12 programs with 4 mental health consultants. Fast forward to 2018, we recognized the need to serve a greater number of children, so we adopted the Georgetown consultation model to build and increase capacity within the preschool programs. The need is due to the growing number of children currently being expelled in the preschool programs. We expanded our capacity from originally serving 3 to 100 programs each year in providing social emotional support. 100 child care programs are currently being serviced thanks to the Children's Trust and supporting partners. We're currently working with a program called Happy Feet Learning Academy as part of a research grant from the NIH, and we would like to share their testimonial.
I am here to thank the Jumpstart Plus program from University of Miami, who have helped Happy Feet Learning Academy to be more organized and who have helped us set up all of our coastal area and dealing with social-emotional development in children. Our teacher has learned new strategy by using this program, the Jumpstart Plus program, to teach children to regulate their social-emotional behavior. Other programs in the county provide the same services as the Jumpstart Plus program, but with a fee. In the meantime, the Jumpstart Plus program does not charge any fee, and they have done a great job.
Due to the pandemic in 2020, our model continued to evolve to include COVID, robots, and iPads, and other technological services to extend our reach throughout the community. As we continue to advance with technology, I will turn it over to Dr. Natali to share our most recent innovation, connection, and impact, which is the mission of the Mailman Center.
Thank you, Joanne. As Joanne mentioned, we are always looking for new ways to innovate and connect with our community. And so when COVID hit, we realized the need to support child care centers and just help them stay open amidst everything that was happening. So we worked with our community to co-create a series of cartoon videos, one is playing in the background, to help parents, teachers, and child care centers follow CDC guidelines. Our community partners were also instrumental in ensuring appropriate translations into Spanish and Creole. Now, the neat thing is, these videos were shared beyond our wildest reach and, in fact, went viral. Not like Taylor Swift viral, but viral in my mind. They were shared with thousands of people, so we're pretty proud of that. Our latest and greatest effort to expand our work is by developing a mobile app to reach even more child care centers. And to do this, we are once again partnering with our community partners, Overtown Children Youth Coalition, St. Law, Connect Familias, to continue to co-create material so that together we can make the biggest impact on the teachers and the families that we serve. Now I'd like to show a video of one of our therapists, Nahimi Tien, sharing some of his personal impacts and connections that he has made within the community.
One of my personal experiences and why I love the Jumpstart program so much is that with reducing the risk of expulsion and suspension, it reminds me of myself as a child. As a child, I was a child who was in different schools and different daycare centers being labeled as the problem child or being labeled as a child who was considered misunderstood. But in actuality, it was more so that I feel like the teachers weren't equipped or weren't able to receive that proper coaching that as a Jumpstart consultant that we provide for those teachers. So now that I have the ability to give back and being able to invest and provide those teachers to be able to empower and help out those children who are more like myself. One experience that I have right now is of a child who was recently kicked out of a program. And one of the programs that he was sort of entered in was one of my programs. And I got to work with his parents, connecting them with a therapist, connecting them with different resources to be able to get that child to be considered more understood and also provide that child with a more happier sense of himself and remove any label that he once had for himself.
And Nahimi's here today. Thank you, Nahimi, for coming and sharing.
Thank you. None of this would have been possible without the support of our team members, dedication, community partners, and our community partners.
We'd also like to acknowledge our generous funders, the Dyson Foundation, the Batchelor Foundation, NIH, and of course the Children's Trust, who have funded various aspects of this grant for over 19 years. And I'd like to end with a video from the Trust talking about the impacts the Mailman Center has made from their perspective.
Congratulations to the Mailman Center for 50 years of excellence. The Trust has been a proud partner with the Mailman Center for quite some time. To see your impact in the community is unparalleled. To the team, your dedication, your commitment, your passion, and your love has made a lasting impact in this community. The 50 years has been great, and we're here to celebrate, but we are really also looking forward to the next 50 years and what we can do collectively to move this community. Again, thank you and congratulations.
So much to celebrate in under 1 minute. First, I'm proud to be a Mailman alum. It's a model for interdisciplinary care with expert practitioners top in field. High quality services that make a difference for children. Some of the Children's Trust has supported over the past 20 years, early discoveries, early intervention services, summer camps for children with special needs, healthy steps in pediatric care settings, Jump Starts early childhood mental health consultation, parent club, families first, parent-child interaction therapy, teacher-child interaction therapy, and even virtual reality. Mailman's core integration of a training imperative makes it stand out from other service providers. Professional training like the psychology internship that brought me to Miami years ago, the Emerging Transformational Leadership Program, faculty and staff that have a passion and commitment to doing the work well and helping others do the same. We're glad to have them as partners in our Trust Academy Learning Collective, including our foundational social and emotional wellness strategies. For all this and more, happy 50th anniversary. We look forward to many more years of collaboration.